Our discussion today is not about a medical condition, but rather something that affects the health of African Americans. October is Health Literacy Month. Health literacy is the ability to understand and use health information to make informed decisions about one's health. According to a study, 58% of African Americans had basic or below basic health literacy, compared with 28% of non Hispanic whites. Low health literacy affects healthcare access and outcomes and is an independent predictor of racial and ethnic disparities in health behaviors, access to healthcare resources, and health outcomes. Some of the barriers to health literacy in African American communities include limited access to healthcare, low educational attainment, and poverty. Strategies that have been suggested to improve health literacy in African American communities include using plain language in health communication materials, providing culturally appropriate health information, and improving access to healthcare services. It's important to address low health literacy in African American communities as it can lead to poor health outcomes. Health Literacy Month, observed every October, provides an opportunity to recognize the organizations and initiatives working to improve health outcomes by addressing personal and organizational health literacy. Culturally appropriate health information is tailored to the specific cultural and linguistic needs of the target audience. It is designed to be easily understood and accepted by the audience, and to be respectful of their cultural beliefs and practices. Some examples of culturally appropriate health information include using plain language in health communication materials to make them more accessible to people with limited literacy skills, providing health information in multiple languages to accommodate people who speak languages other than English, using images and graphics that are culturally relevant and appropriate to the target audience, incorporating cultural beliefs and practices in health promotion messages to make them more relatable and acceptable. The National Culturally and Linguistically Appropriate Services Standards, or CLAS, provide a blueprint for individuals and healthcare organizations to implement culturally and linguistically appropriate services. The CDC also provides resources on cross-cultural communication, translation, interpretation, and language access. There are many cultural beliefs related to health and wellness in African American communities. Some of the common health beliefs in African American communities include using herbal remedies. Many African Americans use herbal remedies to treat various health conditions. For example, some may use ginger to treat nausea or garlic to lower blood pressure. Spirituality is also an important part of African American culture, and many believe that prayer and faith can help to promote healing and wellness. Distrust of the medical system. Some African Americans may be hesitant to seek medical care due to a history of discrimination and mistreatment within the medical system. Family support. That's an important part of African American culture, and many believe that having a strong support system can help promote health and wellness. Dietary practices. Many of us have dietary practices that are influenced by cultural traditions. For example, we may consume a lot of soul food, which is high in fat and calories, but low in fruits and vegetables. Tastes good, but may not be so good for you. It's important for healthcare providers to be aware of these cultural beliefs when working with African American patients. By understanding these beliefs, healthcare providers can provide more culturally sensitive care that is respectful of the patient's values and beliefs. There is one organization dedicated to improving Black health literacy, and that is the NAACP. The NAACP is an organization that advocates for civil rights and well-being of Black Americans. One of its main issues is health equity, which means eliminating the racial disparities in health outcomes and access to care that affect the Black community. Some of the health challenges that Black Americans face include increased risk of chronic diseases and barriers to quality health care, such as lack of insurance, discrimination, low health literacy, and cultural competence. The NAACP works to address these challenges by providing policy recommendations to the government, educating the public about challenges specific to African Americans, supporting health care for all, and partnering with other organizations to improve the quality of life for Black veterans and seniors. Now, I've heard many suggest that maybe the NAACP and other social justice organizations are no longer relevant. I dispute that wholeheartedly. Some may think of the NAACP of the civil rights era and assume that that's all there is to it. Black health initiatives have been at the forefront of what the NAACP does long before COVID shined a light on the blaring health disparities caused by systemic racism in this country. Don't get it twisted, however. Civil rights is still an issue. All you have to do is watch what's happening in our country right now. There is a real attempt to send our country back to a time where people of color have no power. And the NAACP is here for that too. If you are unsure of what the NAACP is or what we do, feel free to meet me on Monday, November 23rd at the Roanoke Chapel Family Life Center, also known as Mudcastle, in Garysburg, at 6 p.m. This has been Dawn Daly-Mack, RN, asking you to always remember that Black health matters.